Hello, my name is Peter Bracher. I'm originally a community public health inspector with the UK government, but I've got about 20 years of working throughout Asia, including living in India, Thailand, and I'm now in Korea. And I've worked for a retail business and also for a certification and auditing business during that time. And I've worked very closely with food businesses in the area, more recently helping them with COVID management. What I've been asked to speak about is COVID in Asia, with particular reference to the food industry. Now, what I don't want to do is give you statistics based on cases by country, because I don't believe we can make valid comparisons between different countries using COVID statistics. There's just too many variables. It depends on the level of testing in a country. It also depends on the definition of a fatality due to COVID, which varies from country to country, and also on the local culture. It depends on if people will go to a hospital when they're ill and present themselves there, and therefore it will get detected and reported, or do they treat at home? And also, with large numbers of asymptomatic cases, it's doubtful what those statistics actually mean. But what we can see is some broad general differences, largely split on population sizes in Asia. We have the very large population countries of India, Indonesia, Philippines, where just simply practical difficulties in controlling it. You've got big rural populations. Indonesia is on about 17,000 islands, Philippines on about 10,000 islands. Extremely difficult. So we've got a logarithmic increase in cases. There's early signs now it's beginning to tail off. But the other countries in Asia have done significantly better, and that's significantly better than Europe and US as well. What we see is small number of cases per day, under 100 in each of the countries, well under in some cases, in Thailand, Vietnam, Taiwan, Korea, Japan. There they have had a much better success in getting COVID under control. And of course the exception on the population split is China. High population, but they managed to get it under control quickly with strong actions. And what I think the difference is between these smaller Asian countries and China is they took it seriously. We have to be honest, in Europe and US, it was a slow start because the governments didn't seem to take it seriously at first. And I think in Asia they had an advantage. The SARS outbreak meant that they'd already had a go. SARS was like a rehearsal for pandemic control. And also the population, they would just normally wear a mask. You know, if you have a cold or flu, it is quite normal throughout Asia to put a mask on when you go, if you're going into the office, if you're traveling on public transport, to protect others. And I think that's quite a difference. So there's the behavioural difference, and there's also the government's starting to take it strongly. I can illustrate this. I recently arrived in Korea. I'm in quarantine now. I was tested at the airport. I was told the next day I was negative. I still had to do the 14 days quarantine. And health officials delivered this to where I'm in quarantine. And this is from the KFDA, the Korean FDA, and it includes a waste bag with a rather scary biohazard symbol on it. So the waste collection people know to treat this differently. 70% alcohol spray with instructions to spray the rubbish and spray anything I've handled, and to also decontaminate before I leave. Rather nice box of hand sanitizer. Else in the goodie bag, a mask that they included. A thermometer, I'll tell you why I need that in a minute. And this very serious looking document saying that I have to stay here for 14 days, and if I go out, I will be fined and thrown out of the country. So that sets a very clear message. And the reason that I need the thermometer is that they also install an app on your mobile phone. Now, this app, you have to update your temperature twice a day and any symptoms twice a day. But in addition, it has geolocation built in. So if I go away from the designated quarantine place, it will phone the local health authority and they will come and see what I'm doing and probably be arrested. In addition, it has a movement detector. So if I tried to be clever and left the phone in the condo and then nipped out to 7-Eleven, it would know it hadn't moved. And it's gone off a couple of times when I've been working on something else and not touched my phone, and it's loud. It scares the heck out of me. So I nearly had a heart attack in quarantine. But also, if you're like in Thailand, like every 7-Eleven started selling these months ago. Handbag size, pocket size, alcohol spray for sanitizing. And masks came in very quickly, no mask shortage. This one I particularly like because it's tight fitting, it has a waterproof outer, a filter layer and an absorbent inner, together with a strap so you can just hang it around your neck if you're eating. And in Asia they've taken to masks well. Here's a Liverpool Football Club mask, yay! And this one's a designer mask that actually turned out to be a bad idea, because in some of the Lotus stores now, Tesco Lotus in Bangkok, they have automatic face detectors, and it can check your temperature using infrared. It sees if you're wearing a mask, and if not, the barrier doesn't open, and it doesn't think this is a mask, so it doesn't detect it. So the general population took to wearing masks, social distancing. The handshake is not popular in Asia. There's the Y or there's a bow. So contact was reduced, and social distancing measures were complied with largely. So that meant that the cases got under control much quicker. So that combined with the strong government reactions. Now, as regards food businesses, they responded very well. What I saw from restaurants and supermarkets was they're controlling numbers of people. They worked out maximum number of people in, they were counting in, counting out. You couldn't get in without a temperature check, and you certainly couldn't get in without a mask. And there was hand sanitizers at all the entrances. And I noticed in Thailand, Korea, they were squirting it in your hands, so you would sanitize as you came in. And they were sanitizing the handles on shopping trolleys as well. So these things all helped at first. But of course, businesses are not designed to run it. Like if you're a restaurant and you're running at 50% occupancy in order to provide the social distancing separation, then you're going to have a problem because you have fixed costs. Any food business is going to have the fixed costs of the rentals, the staff costs, any franchisee costs that they have to pay, any raw material costs, together with any licensing. Now, those aren't going to go down just because there's COVID, but your revenues will. So what I'm interested is, I've seen food businesses starting to respond now in a positive way, where they can work in the new normal, but they can also maintain sound public health controls. So the entry restrictions are still there, but to try and get the seating capacity up, they have rearranged the interior. So supermarkets and restaurants, I've seen them now increasing the rate of ventilation. So they've increased the flow of ventilation, which has been seen to help. They've added filters into ventilation systems. I'm not talking about HEPA filters like on aircraft. Simply a filter that is enough to stop the droplets. You're not trying to filter out the virus. The virus doesn't travel by itself. You're trying to stop the droplets from being recirculated so that the ventilation system itself won't be a problem. And what you have is multi-layer control. So checks on entry, everyone wearing a mask, staff wearing a mask, staff social distancing. They have menus now that you can scan a barcode, so you don't need to be handling menu that someone else has handled before you. You have increased ventilation, you have filters in the ventilation system, you have rearranged seating and the screens between the seating. So you can get the density up without people putting others at risk. Now, if you combine that with a generally lower number of cases, and you have a viable business model in the country. And I've been impressed with how the businesses have responded. I've seen masks that are part of the uniform. Burger King, KFC example. They have masks colour-coded with the uniform, with the logos on. It's now a standard fitting for what the staff wear. And to be honest, I'm sure a lot of you would agree as food professionals, shouldn't we have all been wearing masks anyway, without a pandemic? Because we don't want to be spreading colds and flu. And there's also staph and norovirus that could be spread. So everything about the new normal is not bad. There are some sound public health practices that I think will extend well beyond COVID. So What I can see now is businesses adapting, and what they've assumed is this is going to be for the long term. It will be a mistake to base your business strategy on the hope that vaccines will save us. Production capacity for vaccines, even if the vaccines are successful, are simply not going to mean that everyone will be vaccinated anytime soon. And I noticed after the British Medical Journal estimated that the effectiveness of vaccines could be as low as 30%, that had a direct impact on the shares value for the vaccine companies. 3 days later, there's suddenly a big announcement, oh, it's 90% successful. What I saw in the Lancet was the current tests of the test, is it safe? They don't yet have the volumes of people being tested to say how effective it is. So that's an estimate. It could be 90%, it may be 90%. But the actual vaccination rates, there will be anti-vaxxers campaigning against it. There will be simply limits in production capacity. I think vaccination will help international travel. You can have a vaccine certificate. It's not going to help food businesses. So what you have to do is review your design. Look at the ventilation systems, the filtration, the layout, and the staff behaviours. Put in screens and see if you can get your occupancy back up to what it was. And then in supermarkets, everyone wearing masks, sanitising trolley handles. They have screens now on many of the checkouts in Asia, so the staff are behind the screen, just in case anyone removes their mask or there's any droplet infection. It is multi-layer. You could pick holes in any of these and say, well, masks aren't 100% effective, screens are only 20% effective, temperature controls, don't detect asymptomatic cases. That's missing the point. If we do all of this, if we change our behaviours, we improve our hand hygiene, we don't touch our face, we wear a mask when we're in public places, we avoid crowds, we try to social distance, we stay away from others if we have a fever. And if businesses, with a combination of improved ventilation, screens, layout, staff training, we are reducing the chance of infection spreading. All we need to do is get that R number, the number of people who are infected by any individual case, below 1, and we have the situation that we currently have in Korea, Japan, Thailand, Taiwan, China, Vietnam, Singapore, where the cases are low. I mean, you'll see on the news reported cases, there might be 100, but that's 100 like in Korea in a large population size. And that's probably a reasonably accurate figure because of a very high level of testing. So as food business operators, we can do our bit. We can change how we work, change our staff behaviours, and do it for the long term. It's worth investing in improved ventilation systems, in improved cleaning, in hygiene squads going around the restaurants, because this is going to be at least another 12 months. Anyone banking on vaccines, giving us a good, sorting it out by the end of the year, will be disappointed. I'm 100% sure. And I've got, 45 years public health experience behind me. And this is not the first pandemic. It is different to flu, but from an individual's point of view, individual risk point of view, not that different. It is actually not as serious as SARS or MERS in the Middle East. We've had this before in Asia, we got over it before, but it takes time. So look at your businesses, you're planning budgets for next year, budget for improved ventilation systems, cleaning squads, hygiene checks. Might be a slight reduction in occupancy rates, but if you design it properly, you can probably get it back up. And in Asia, I think I've been impressed. They've shown other countries how to do it. Take it seriously, education, local community health people, making sure that people are wearing masks. And it's now time to look at this underclass, and we have it in the food industry, if we're honest, immigrant labour living in dorms with shared facilities. That's where most of Singapore's problems are. If we invest in proper facilities, if we invest in separate hygiene facilities, good washing facilities for dorm workers, then that will be an investment that will pay off and help protect our business. If you look at some of the major clusters in Germany, in the US, in Ireland, it's been meat plants. And that's because you've got an environment where people shout. They shout at each other to communicate because it's a high noise environment. That spreads it. Mask use may not have been as good as it could have been. People work shoulder to shoulder on the line. And after work, a lot of the labourers will then go back to dorms where they're sharing facilities. Is it any wonder that there are clusters from meat plants? Now, the good news is that, despite some scare stories, and I think the press really like to exaggerate things, it does not seem to be foodborne. It does not seem to be transmitted from packaging. So this is person-to-person droplet, not airborne, but droplets suspended in the air spread. So that is not that difficult to do. Good hygiene practices that all of us will be aware of in the food industry, that we expect in food factories, the masks, the hand washing, the good personal hygiene. That's all we need to do. Hope you found that useful. Thanks a lot.